During my interview, Reading Hospital blew me away. Not only the size, but all the interactions that I had with the staff members. Everyone was super nice and super approachable.
The faculty here at Reading are really phenomenal. They are very approachable and they all love to teach.
They're all very helpful. They all care a lot about making sure our experience here is everything that we want it to be.
They're continuously asking you questions and testing your knowledge to make sure that you're able to understand what's going on with whatever case is occurring.
Within our class, I think it's like the perfect size where we have a good camaraderie, and in addition to that, we are able to have a good relationship with all the attendings.
At a very large institution and being a level 1 trauma center, I think we're largely moving towards an academic program, but right now we still have that great crossover between a community program and a community feel, but with the perks of an academic program.
One of the aspects of technology that I really like here at Reading is there are several operating rooms that have the Da Vinci robot. And as a first-year general surgery resident, I've already gotten to do simulations on the robot and work with the Da Vinci representative.
I think it's pretty unique to have such early exposure to the robotics. It's actually nice to have practice in those Da Vincis and to get a feel at a very early stage in our training.
There's a lot of ORs here and a lot of OR availability time. I have seen in other programs where OR time is severely limited. And so you're able to do the cases that you need to in a good amount of time. There's not a lot of time lag between putting on a case and having a case go, especially if it's urgent or emergent.
One of the perks, I think, is that we do have access to dictation services. So we have the smart microphones where you speak into them and you can basically dictate the rest of your note, which I find saves a lot of time and is a lot more efficient, especially when you're trying to get to the OR.
Even during my first rotation in trauma, I was really hands-on in my rotation. I was already on call, and those experiences are very, I think, crucial and vital to my learning process, because you really get to learn how to manage patients.
One of the reasons that I chose Reading Hospital to do my general surgery residency is that they see a lot of bread and butter general surgery, but they also see a lot more complex cases. And recently they've gotten the transplant program, so they'll do liver, kidney, and pancreas transplants here, which I have an interest in transplants, so that was very appealing to me.
We are exposed to a great number of subspecialties here at Reading Hospital. I think that's a great benefit of the Tower Health system, is that we have access to a lot of subspecialties, if not immediately at our fingertips here at Reading Hospital, but through our affiliates with Tower Health.
I've done plastics, I've done vascular, I will be doing CT surgery during the fall, early winter, and then we'll also be we'll have an endoscopy rotation as well as transplant and pediatrics. So I think we're going to be pretty well rounded by the time we finish.
I laugh and smile every day at work. I might be here for long hours, but I honestly love coming to work, and I think that can't be overstated.
It's by far a incredibly welcoming place. It's encouraging, and I feel so supported by my colleagues, by my attending physicians, and I feel really lucky to have a place that has such a collegial environment to start this next phase of my career.
I'm finally doing what I always wanted to do, and that's to help patients and to be really hands-on with that, and Reading Hospital really provided me that kind of opportunity.